If you've learned a lot about leadership and making a movement, then let's watch a movement happen start to finish in under 3 minutes and dissect some lessons. First, of course, a leader needs the guts to stand alone and look ridiculous. But what he's doing is so simple, it's almost instructional. This is key. You must be easy to follow. Now here comes the first follower with a crucial role. He publicly shows everyone else how to follow. Notice how the leader embraces him as an equal. So it's not about the leader.
Innocence will prove in Irish. Do I just say cancel?
Anymore. It's about them, plural. Notice how he's calling to his friends to join in. So it takes guts to be a first follower. You stand out and you brave ridicule yourself. Being a first follower is an underappreciated form of leadership. The first follower transforms a lone nut into a leader. If the leader is the flint, the first follower is the spark that really makes the fire. Now here's the second follower. This is a turning point. It's proof the first has done well. Now it's not a lone nut and it's not two nuts. 3 is a crowd and a crowd is news. A movement must be public. Make sure outsiders see more than just the leader. Everyone needs to see the followers because new followers people, then 3 more immediately. Now we've got momentum. This is the tipping point, and now we have a movement. As more people jump in, it's no longer risky. If they were on the fence before, there's no reason not to join in now. They won't stand out, they won't be ridiculed, and they will be part of the in crowd if they hurry. And over the next minute, you'll see the rest who prefer to stay part of the crowd, because eventually they'd be ridiculed for not joining. And ladies and gentlemen, that is how a movement is made. So let's recap what we've learned. If you are a version of the shirtless dancing guy, all alone, remember the importance of nurturing your first few followers as equals, making everything clearly about the movement, not you. Be public, be easy to follow. But the biggest lesson here, did you catch it? Leadership is over-glorified. Yes, it started with the shirtless guy, and he'll get all the credit, but you saw what really happened. It was the first follower that transformed a lone nut into a leader. There's no movement without the first follower. See, we're told that we all need to be leaders, but that would be really ineffective. The best way to make a movement, if you really care, is to courageously follow and show others how to follow. When you find a lone nut doing something great, have the guts to be the first person to stand up and join in.
What he showed clearly was great courage. One of the first of the 6 C's is courage. And courage actually comes from it's actually a Latinate origin coming from the word heart. And to have heart is to be not afraid to stand out, to do something ridiculous and not be afraid of it. But you know what? It wasn't about the leader, was it? It's about the follower. And it's about hope. Václav Havel was a Czech poet, and he became president, in fact. And he talked about hope as not something that's about expecting you'll succeed. Hope, and if you like, courage, is about doing something anyway because it's the right thing to do. And where you work in primary care, actually often what you need most is courage to keep going. Caring is it's an old High German, a medieval German, and that talks about in terms of grief. You look at its Latinate origin, cara, which is about belonging and taking care of. Also, cara, incidentally, by coincidence, is the Irish word for a friend. And we talk about caring as something that's innate to nursing, but it's actually something that's wrong in all of us. Compassion, I love looking at words and seeing what they can also be transmuted into. And compassion is a word that blends compass and passion in the same word. Your compass is your lodestar, your guide to take you places, and your passion is the stuff, the energy that gets you going, that keeps you there. So knowing where you're going and having the strength and commitments to keep going. Commitments too is it comes out the word commit. I commit to do something. I desire to do something. I'm passionate, and I will not be. And Nietzsche said, people will put up with any what if they know why. And Malcolm Gladwell's last book, David and Goliath, and just as an aside, while not all readers are leaders, every leader reads. So while not all readers are leaders, every leader reads. And it is incumbent on all of us to read beyond the paradigm of our health and our specialty, but to look well past that to inform our thinking. And Malcolm Gladwell, in his last book, David and Goliath, talked about how superpowers, super military powers, whether they're the Roman Empire or the Nazis or the US forces or the British, they only won 70% of their wars. And they only win 70% of their wars because it's completely unbalanced, the Vietnam being a good example, a peasant army in every sense. But because those people were committed, the individual dying didn't matter. What mattered is they believed passionately they were part of something bigger than themselves. And it's really hard to bomb ISIS into submission or the Taliban. And Andrew Hagan is a Scottish journalist who embedded with the American and British forces in Afghanistan. And they captured this young 9-year-old boy with wearing a suicide vest, and he was imprisoned. And his mother wrote to him. And his mother is in Helmand Province, and his mother wrote, "Don't worry, son, you'll get them next time." Now just unpick that. Any of you, how many here are mums? Just as a by-the-by. Most. Can you think of, those of you who have children, or those who aren't and have relatives, could you imagine writing to your child, just saying, "I'm sorry you didn't get killed, but you will next time because you'll be doing it for a greater good"? So that's commitment. Competency contains the word compete, but it's also about our capabilities and our willingness to get better, because good enough never is. And then there's communication, and that's about we cannot over-communicate, because when you think you've communicated enough, factor it by 10, and you're just starting the journey. So those are the 6 C's. Just coming to the panel, that's some thoughts that I've got. What are your own? If I may, let me start with, we've got Tracey Johnson, who you're going to hear keynoting tomorrow. We've got Heather, you've heard this morning, and President Karen Brood. But Heather, let me just start with you. Observations, thoughts.
Hello, my name is Heather, and I particularly want to talk about courage, and I want to give a practical example from this morning when I was talking about the fathers. And actually, I guess I was the one who started. No, I wasn't the one that started the dance. I was the project manager. And the guy that started the dance was, I can talk about him because he's left now, but was a former armed robber. And they attacked a jeweller's with a machete. This is in Salford. He was also a father. And he was the one that started the dance, and using appropriate disclosure, he talked to other fathers about his life, usually on a one-to-one. That showed extreme courage, and courage on my part, because I had absolutely no idea what would happen. I mean, this is in the middle of Salford, and a gang culture is very prevalent. And that struck a chord with the other fathers. I was telling Brian that the first time we brought the fathers together, we brought them together in a cafe in the middle of Little Hulton. And I wanted to ask for their help to judge a children's competition, because I thought that any father has the right qualifications to do that, to find the best father in Little Hulton. And what happened was that first father, the fathers knew about his background, and that was the moment in the middle of a cafe in Little Hulton where those fathers started talking about killing. Had they ever thought about killing themselves? And that was a moment when you could hear a pin drop. And that morning when I went to work as a nurse, I joined the conversation a little later on, because men don't talk about their feelings generally in front of women. And I didn't want the conversation to change, so I came a little later. So the point of this is courage, and also the role of the first follower. And John was the guy that started talking about himself, but that enabled another guy to lean forward and start talking about the things that really mattered to him. And I would encourage all of you to come forward and go to work one day and try something, and have the courage also to fail, because we don't talk about failure often enough. But failure is an opportunity to learn. So if we're not making mistakes, we're not learning.
I guess for me, in looking at these 6 words, and I wholeheartedly endorse all of them, one of the things that struck me when I saw the list was that I know in my own work, compassion is something that drives me every day. I have these really disadvantaged patients that at times when I'm thinking this is all too hard, I'm exhausted, I'm doing too many hours and being paid way less than I could be elsewhere. And I know that that's the common story in primary care. By looking into the eye of need, one is all of a sudden compelled to do more. So by having compassion, we generate that commitment, that ability to rise up. And certainly in my life circumstance, I started out with an economics law degree in merchant banking, so no one would have ever thought that I would have ended up being the CEO of a charity in a really disadvantaged area. But it's because tapping into that life story and that sacredness that everyone has and wanting to serve that and do the best by it, I've changed, and hopefully the lives that I touch and my team touch has changed. But there's no good having, tears running down your face and going, oh, this is so terrible, I want to do something about it, unless you're prepared to follow through, compassion to commitment, and then to courage. So, a number of times in the last 12 months, I've stood in the corridors of the practice that I'm part of. We have a lot of refugee patients as part of that practice, and sometimes for men who've been removed from everything they know and who are very insecure and often subject to discrimination in our country, the only power that they have is the power to reproduce. That makes them feel like a very important man. And a number of times when their wives have chosen to use contraception, often without telling their husbands, those men get quite inflamed. And I have to say, when I look at the eyes of those 4, 5, 10, 12 children that some of those women have and the fatigue in their eyes, I don't care how angry their husbands are, I don't care how abusive they are to my staff, but I've stood in between those men and their wives and their children and told them to, call it off. That's what courage can do. I'm not a large person, but I can be larger than myself if I have the right cause. So understanding the stories in front of us, understanding what they are and the dynamism that they have, and being empowering of yourself, and then being able to willing to share their stories and communicate. And one of the things that I see in the nursing community is we've got a lot of compassion and a lot of commitment, some great stories, but we never tell anybody about them. We don't communicate. And until we start communicating, perhaps we won't have the courage to take the platform of leadership.
And building on that, compassion and caring, I think these are key qualities that are associated with nurses. And I think that's something that is key to trust with our patients. And I think we can actually then, we manage to use that trust to actually help the patients through to plan to see a future with their health. And I think competency, you build competency, and you build it being armed with knowledge and research, researching what we need to share with the patients, but also the deals that we have to sell to other health professionals to make sure that we actually are focusing on better care, on better ways and innovative cares for patients. And looking at courage, building on those things, I think you have to have that sort of competency and awareness and knowledge to actually, it helps to build courage that then you can lead the way. And like the man who was the first follower there, I think nurses are early adopters, and certainly we know that nurses are change agents, which is why we're so key and so crucial to actually helping primary healthcare function, get ahead and be meaningful.
So you've heard, these amazing women, some really powerful stories of courage, of leadership, of change, of compassion, commitment, communication. What I'd like you to do now, just for a couple of minutes, talk among your tables. Think of an example of courage that you had showed your workplace when you spoke power to truth when you were afraid. Your compassion, the moments of compassion that you see among your colleagues, the caring, the way people communicate, the competencies. What are the stories you have to tell so that we can advance our profession to articulate what it is that adds the great value in primary care? Talk away among yourselves for about 4 or 5 minutes. So, do you want to tell us what you talked about? What did you talk about? Now, this is where you have to. Now, here's a teaching moment. There are times you're going to get past the microphone. Okay? You got to step up because you don't get the chance. What happens if we don't take the microphone and share our voice? Our voice is silent. What happens then? We bitch about we didn't take the opportunity, they didn't listen. Now, this is not about an individual. This is about us as a profession. Grab the mic, use our voice, make it roar. Just stand in fine. Talk to this.
Hello?
Yeah.
Anne over here spoke about an incident a couple of days ago, or maybe a week ago, where the practice's refrigerator, or the power went off. So one of the nurses who was employed in the practice came up or had the courage to say to the practice manager and the doctor, sorry, but we can't use these immunisations, so we're going to have to discard of them. And obviously they weren't very happy about that, but that was a good example of courageous.
Absolutely. And in fact, Heather and I know a joint friend of ours who was sacked because she had the courage. And it was exactly that situation. The fridge broke down, didn't it, Heather? And she said, we cannot use these vaccines. It is harm, we would cause harm to patients. And she spoke up, she had the courage. And you know what? It's led her into a position where she is now a national leader. She's a national. Leadership is doing the right thing on a difficult day, as is courage. Okay, anyone else? Thank you, by the way, having your courage to speak up, because the next time you do it, it'll be easier. Over here? Oh, please do, yeah.
So we've got an example of a doctor that's old school and due to retire, but when it comes to doing dressings, they like to use peroxide, which I can't, and of course we know not to use peroxide. So I got the standards book, and we had, that to use as ammunition. So we had the courage to stand up to them to start with and say, this is not what you use anymore, and it's not good for the wound, and it's, really bad for the wound. And then to have the standards there to sort of back me up, which was great. And we sort of have that rapport now. I think they respect you for it after a while, but it's very hard at the time to say it in front of a patient or, to work it out and communicate through that. But it's, and to be caring and kind enough to help the patient get the wound fixed without,
Killing it with peroxide.
And also being caring and kind enough to point out to somebody actually they're completely wrong. Because actually being right is never enough. Being right isn't actually, the evidence is never enough. We've known since 1969 that hydrogen peroxide is cytotoxic in granulating tissue. We've known this for nearly 50 years. But it's being kind as well as courageous, so showing compassion. And another comment coming over here.
Is it on? We have a lady here who 2 weeks ago resigned from her position because she was unhappy with the way the practice was managed. And I think that takes great courage to stand up for her principles and take the time off.
You do know you're going to be grand. You will be grand. You'll be fine in life. Because you're going to look back on these days and say, the hours before the darkness, before the dawn are always the darkest. And once you've made the decision, the brave decision, actually the light starts coming in the door. You'll be grand. Anybody else? Anyone? Oh, there's one there beside you, Ben. Can't even.
I finished uni and went straight into general practice. I've been there for a year. The 2 full-time nurses that were working there both resigned and left me with 18 GPs, and had the courage not to run away.
So it was 18 doctors and one. They didn't stand a chance. One more.
We were discussing at the table here, and I'm just going to pass the microphone over to Danielle, who has shown a huge amount of commitment to being a practice nurse, and it's taken her a couple of years to get there, but...
This is also known as a hospital pass.
In Queensland, I work for HealthScope, and we have 8 medical centres, and the nurses feel very isolated in the chronic disease management area. And I've organised a conference, including some guest speakers, some nurse forums, and had some sponsorship to try and create a network and help those nurses.
There's just one other one over here, and I like the fact that you're acknowledging and celebrating through your applause these things. Lovely.
I think in light of that story, we need another C, which is camaraderie.
Yeah. Nice touch. So, what we've heard stories of people who've got brave enough to make the hard decision that impacts on them economically. We've got people who are brave enough to say, do you know what? 47 years of research shows that this may not be the best type of wound cleaning agent. We've got people who have had the mic and actually discovered, you know what, this is not bad, I can sing the next time I do karaoke. Commentary from the panel, any thoughts, observations, heckles?
Don't know that this is a heckle. I think one of the things that strikes me listening to these stories is that so often as professionals, and nurses are an esteemed profession, we narrowly define what our competency is, and typically for a lot of healthcare professionals, they define their competencies in clinical terms. The stories that we've all heard are actually broaching into a range of other competency areas that, let's face it, a lot of you are mums, so you participate in PNFs and sporting and organising fates and managing family events and negotiating all sorts of things. So there's all of these other parts of our lives that we can bring into our professional life and say, you know what, pat on the back, I'm actually competent at this, I can run with it. And that's really important because as Heather highlighted this morning, our roles are changing, the nature of healthcare in communities is changing. So some of those community activation and community engagement skills that you've probably never labelled that way, but that you've been actively involved with for decades are actually one of your best toolkits in this new world of healthcare. But beyond that, there's this constant need to keep updating our competence. And if we fail at the first hurdle, don't go, oh my goodness, I'm never going to try that again. Go, well, hang on, what worked or what didn't work? And you might be able to learn from that and reframe your competence. Or you might be able to find somebody else or a course or some mentoring to gain increasingly broad arrays of competence.
Brian mentioned what happened in North Staffs, which was profound and dreadful and did the profession at the time a lot of damage. And so I think we need to talk around compassion and what's been happening. Certainly I can only talk about England, around the compassion of nurses and why the 6 Cs are so important to British nurses. And that is around emotional labour. The staffing levels on the wards in some of the hospitals, and especially for North Staffs, were very low. And it got to the stage where, as Brian was saying, the patients were drinking out of the water vases because they couldn't get their jugs topped up. And I looked to the work of my colleague Yvonne Sawbridge at the University of Birmingham, and I took over from Yvonne as Vice Chair of NHS Alliance, first of all, so I look up to her very much. And she's done an awful lot of work on emotional labour, because when your staffing levels are low, there comes to the point when you begin to lose your compassion. And a bit like the crazy dancing guy, be public and be easy to follow. If you notice that your colleagues are beginning to walk away and beginning to not see what's happening, these are the danger signs that nurses are losing their compassion, perhaps through the emotional labour that they are going through. And Yvonne was working with the Samaritans, in fact, in Birmingham, to do some research to see whether there was an opportunity at the end of every shift for nurses to come together and talk about what, do a debrief. That might be something that could be considered. So rather than going home and having a rather stiff drink, as many of them might be tempted to do, it's actually reconnecting back to each other and thinking about what's happening around compassion.
Karen.
I think for me there were key themes that came up from all of those comments that came from the audience. One of them was courage, and courage to stand up and say no. Courage to look to speak out safety versus cost. I think we talked, there was a comment about isolation, but then led to leadership and innovation in networking. I think courage to protest, and it does take courage to walk away. And the nurse, the new grad that's working with 18 GPs gets a bravery award. But I think the other key word that came out of there is camaraderie. And I think camaraderie and all of those things are why you're here today. And I also think that nurses are really well recognised as the gatekeepers for safety and quality in their workplaces.
Absolutely. Emotional labour was first developed by Pan Am in the 1960s, because what they were trying to understand was how could they get the best air stewardesses or air hostesses as they were back then. The way they were trying to understand is what was it that was good about some of the air hostesses which the passengers really liked. Effectively, they were trying to do is gather the competencies of good people. And their driver was, if we can recruit people based on these range of skills and emotional capabilities, we will recruit the best people, which will make our company more successful. That was the driver. And there was a woman who trained, I trained in London with my general nursing, and her name escapes me at the moment, but she looked at emotional labour in nursing. And it's about and I've always thought that people don't burn out because they care so little. Often it seems to me that they care so much. And there's not a huge difference between going from caring to careless and from careless to callous. It's not that somebody wakes up one morning and becomes that callous person. It's a transition to that state. Having said that, I'd also make the observation that some people will never burn out because they never warmed up in the first place. Actually, Heather, can I just get it? Because you made a really interesting point as you saw people gathering. Do you want to make an observation about that?
Yeah, I want to explain a little bit to you about complexity theory and my observation of what happened during that exercise. And quite often in healthcare systems, we set out a cunning plan, don't we? And we say, this is how it's going to be. We're going to do A, followed by B, followed by C, followed by D, and we're going to do it in this timescales to this price, yeah? And then it doesn't work, does it? Because we know that classic phrase, culture eats strategy for breakfast, yeah? Now, I want to introduce you to the basic principles of complexity theory, which have been operating in this room today. We had a rough plan for how this was going to go, and you saw that actually some things changed because perhaps the technology didn't work. And then we gave you the enabling conditions for you to self-organise, didn't we? And you decided how you were going to sit, who you were going to talk to, the conversations that you were going to have. And complexity theory states that basically the people who are in the room are the right people, and the discussions that you have are the right discussions, and all we need to do is to set the right conditions. It's a bit like, when you see flocks of starlings or waves that crash on the beach and things like that. In certain conditions, people will decide for themselves, and our role in this instance is to just allow those things to happen, maybe give the pot a little stir occasionally, and that's what I began to see. You began to organise your tables. It was quite interesting to see who spoke first, and quite often the people who speak first might not be the natural leaders, and then there'll be other people who controlled some of the discussion and things like that. And so take that back into your practice. Say sometimes when there are very stable conditions, you can do the mechanistic planning and it will work. But when you're working with people, and particularly when you're on the edge of chaos, not saying at all, Brian, that this is the edge of chaos, not at all, people will self-organise, and actually you've got to allow that to happen. I resisted my natural temptation to do a lot of talking, although I am doing it now, so I'm going to be quiet. So you get the general idea, yeah? Okay.
I was fascinated watching people pulling tables together. So instead of having islands, what you had was the New South Wales continent, which is good. So since we're talking New South Wales, any comments, observations? Heckles on the back of a $10 note. Thank you. Yes, please. Oh, yeah. Ken's gone over. And anybody else wants to make a chip in?
Yeah, look, I'd just like to comment on something that was said earlier about that, around the courage and around nurses speaking up, and when we're obliged to do so. And I'd just like to, on a political note, just point out that nurses and doctors in Australia are being subjected to the Border Force Act, which is threatening nurses and doctors who speak up about the conditions in immigration detention centres with 2 years jail. And I don't know if anyone saw the Four Corners program a couple of Monday nights ago, but we've had doctors come forward to talk about what they know. So it's been a bit of a direct challenge now to the federal government to basically say, come and arrest us. And the Border Force Act actually directly contravenes my obligations under the Australian Nursing Code of Conduct and the Australian Nursing Code of Ethics. And I just would like to thank APNA for some of the support that they've given politically in the last couple of months, and the statement and the press release that they put out, because this is affecting the nurses that I work with and myself and other colleagues, but we're the first group to be affected. So I just want to say it does take courage, but it also may take the skills and the pro bono work of a very good QC to allow us to do that. Yeah. But that's on a good point. We have been offered, some of the best legal minds in the country have stepped forward and have told us that they will defend us pro bono for free. And so there are other like-minded people in the country who are willing to defend truth and honesty as well. Thank you.
Dream out loud at high volume, nothing will stop you. And actually, right in the middle of a contradiction, as John called it, John Glenn, the actor, said, right in the middle of a contradiction is where the energy is. And these are quite contradictory approaches, but actually it's the immovable object meets irresistible force. And if you don't think water is strong, watch what it does to mountains. So, any other comments around there on that table? Moving away from the Border Act, anything else you'd like to chip in? What else did you talk about? New South Wales goes silent. There's the first. There we go. Oh, good. You'll love this voice.
And the silence happens. I brought up the point about I'm mainly an acute care nurse. I've been in acute care for 20 years and I've just moved into primary care, but it's a secondment, so I'm not necessarily going to be there at the end of next year. And part of my role is nurse manager at the practice, and another part is the project lead for integrated care. So there's huge amount of change happening on the one hand, and on the other hand, what I have seen is practice nurses who really want to make a difference. They're two new staff who really want to do their best and improve themselves and deliver good quality care, but actually the isolation that's there and some of the political issues that happen can sometimes, I suppose, lock them away from that camaraderie and the support that can be available to them. And I suppose it's things like this, when you come to conferences and meet other people, that you can decide to break down those boundaries one at a time.
Well said. Well said. Is there anybody who's not Irish in the room? Is this the Queensland table? What did you have to say for yourselves? This is where everyone goes looking around thinking, oh, jeez, no, don't ask me. I'm feeling awkward. We'll walk past you. Oh, there we go. Here we are.
So we just introduced each other so we knew where we were all coming from, literally, and sent around a notepad with all of our contact details so we can form a little network after the conference.
Nice. Love that. Love that. And you know now what you all have to do, don't you? And, you know, just get on with it, you know, because the power of APNA is actually, it's about a networking opportunity. That's gorgeous here. Thank you. You're worth your weight in petrol, you lot, already. Now, we have a woman here from the Department of Health. I know, she says, no, don't be picking on me, you know, we're not doing that. You can just feel the love. What would you like to say? What would you like to say? What did you talk about?
So I was talking to Mari. My role is at the Department of Health in a policy area. So we look after the Practice Nurse Incentive Program. So I was asking Mari all of these questions because I'm fairly new to the Department of Health. And what on a good day does a practice nurse do? And it seems like she has a very hectic workload. So it's very insightful. Yeah, very insightful.
Thank you. And over here, we have Tasmania. Is it Tasmania and the ACT? Oh my God, I better get my phone.
And New Zealand.
We'd have never known you were in the room. Yeah, normal hostilities will be resumed shortly. So, what did you have to chat about?
I guess we were talking about the similarities, I guess, between two small states, or one state, one territory, and the fact that Tassie gets left off the map for everything, literally, and communication difficulties, physical, technological difficulties for these guys, and for us sometimes too, around mobile coverage and all that sort of stuff. So just, yeah, generally having a chit-chat and saying how awesome we were, I think. And organising our holidays. We'll go to the Northern Territory and I'll go to Tassie.
And that's what networking is about. You're finding new best friends. And actually, it's about that thing, you know, you're picking up a point there, which is about realising their shared challenges. And things that you fixed ages ago will be a great insight. We had no idea. Oh, that was something we did ages ago. And that's the value of the conferences. Great conferences are about the conversations offline, not just the talks in the company. Over here. Have I done you yet? You're looking very nervous. You're not? Okay, you got it. Here's the mic.
So we discussed the differences between our places of work. So myself and Amanda both work in the correctional setting, and Heather and Cecilia both work in general practices. And we were just discussing the stigmatism behind working in a correctional setting compared to a primary healthcare setting, but also the similarities between the two, and that we're both there to provide patients with the best possible clinical outcomes.
Fantastic. Because everyone has got far more in common than to divide. So that's really great. Yep.
Any from this back table? We sent Victoria up the back for a reason.
Yes, we saved Victoria for last. We talked about compassion fatigue. Oh, sorry. Oh, blast. Never mind, I was wrong. I'll admit it. Compassion fatigue, what can lead to that, and what might be some solutions. We happen to have an APNA nurse lead network coordinator here, and we talked about commitment and how nurses might commit to that space, and the incredible commitment these volunteer nurses place in getting other nurses together, giving them opportunities to have conversations, professional development, finding solutions to the issues in their practices. Competencies, they also get opportunities to look at their competence. And somebody got into a lot of trouble a few years ago when they shared a fabulous tool, which is now utilised throughout the region, but at the time it belonged to the practice despite her development of the tool, and that caused a lot of anxiety for her in sharing a great tool that improved nurses' ability to provide care for their community. Caring, communication and courage came up in the first items, and is there anything I've missed particularly? No. I think the challenge for some people in their practice is allowing them to share, that practice is a business. They don't always want good ideas to be shared. It belongs to them. So that's a challenge for a lot of nurses in sharing great ideas and innovation.
And hopefully they'll stop using hydrogen peroxide at some point.
Do we have anyone brave enough to speak from the last table?
You're over here as well. We haven't heard your voice.
We can have Victoria Mark too, but we're in Victoria. We need to break it up a bit.
Yeah.
Hi, we spent the majority of time actually introducing ourselves and using the time as networking, but there were a couple of things that came up, and one of them is confidence. So there are the 6 C's, and we've added camaraderie, but also confidence, because confidence to challenge yourself, confidence to perhaps challenge your patients and to challenge the other health professionals that you work with to actually embed or implement change. So, and the other thing that we started talking about was the PHNs and the future role of things like the healthy Medicare policy direction, and also the medical home. So the implications of that for nurses who work in primary care, not just practice nurses.
Thank you. Emily, I'm just going to pass the book to you.
Sure, thanks, Brian. Hi guys, I'm Emily from APNA, and we had a bit of a discussion about what it is for primary healthcare nurses, what binds them together, what is the qualities that primary healthcare nurses have that may differ from other nurses, and Julie from ANMF raised a very important point that perhaps we shouldn't be comparing ourselves to acute nurses, but focus more on what the strengths are of primary healthcare nurses and celebrate that, which I think is very important. Brian, in a discussion yesterday with Brian, he suggested we should be asking the clients, the people that we care for, to describe our role, which I think is a really interesting approach to help to articulate what people see the need for primary healthcare nursing, what they see, what they need from primary healthcare nurses, and how they would describe us as nurses. So we had a bit of a discussion about that. Anything I've missed?
Thank you very much. Sometimes the hardest questions to answer are the most seductively simple. Like, what do patients think you do? Esteemed panel, any comments or penultimate comments?
Yeah, I wanted to pick up on the comment about practices being unwilling to share. Of course, in England, that's also was true because practices are independent businesses and are in competition with each other until the moment when they realise they face a common threat. And we can create those or put them in the minds of primary care practitioners. And so I remember the moment in Urmston, in Trafford, where I live, close to Sale, when a practice vacancy was advertised, and we brought the local practices together to say, if you don't cooperate and think about taking over this practice, then Virgin Healthcare or something will come in instead. And that was the first moment that I saw those practices start to collaborate. So going back to those 6 C's of communication, think about how you can come together with common purpose, either to overcome a common threat, which could be managing that tsunami of chronic disease, because together you are stronger than you would be apart, and see what happens.
One of the things that strikes me as well is, what is the culture of nursing? So myself and a colleague have just done some research about a renal service that we're running in primary care, and we had a number of the respondents to the survey when we asked them what was the role of the nurse, and this is a cultural thing. that they said, oh, well, they thought the role of the nurse should be to ring them and remind them about their appointments. And I think both nurses and patients at times undervalue the role of a nurse, as if a nurse should be ringing a patient and reminding them about an appointment. An admin person can do that. So I think the culture that we have, where we sort of sit back, and I hear it so often in different forums where we say, oh, I'm just a practice nurse. It's like somehow we're not important enough to demand the respect, to define our roles in ways that are appropriate to the need, and to stand up. The other thing that I heard as I was circulating a number of times, and again it's sort of linked to this culture of I'm just a practice nurse, I'm the least important person in the practice almost, is I heard a number of people in the different tables talking about when they first arrived in the practice. Someone from New South Wales was talking about how the practice manager inducted them into how to do health assessments and what the protocols were and whatever. Another person said, I have no toolkit, I've just arrived, I've never been in primary care before and I have no toolkit to use, etc. So for me, if you look at any high-performing industry, any high-performing organisation, they actually have a codified set of this is the way we do it around here. And if I can encourage you to read one book this year, it would be to read Atul Gawande's The Checklist Manifesto. He really looks at the healthcare system through the lens of the airline industry. He's a surgeon and says, you know what, until we get our act together and really start codifying exactly the way things can, should and must be done, we'll never get quality, safety, and when you're extremely stressed, things happening routinely so that good things don't happen to, or bad things don't happen to good people. And what strikes me about a role for APNA, a role for you and your state collaboratives or your regional collaboratives or whatever else, is to form that coalition of the willing that we've started seeing happen today and say, what are the resources that we can share? What are the basic minimum standards of operation? How do we do things around here? And then use that to get respect for your sector. Use that to get the resourcing that you need, the training that you need, the position descriptions, the different levels of career path that you need. It's only when you start being clear about who you are, what you do, and how you offer value that you'll get that.
Thank you. Emily, second. Oh, it's Atul Gawande, spelled Gwande. And while Tracey was talking, what I'll do is I'm going to give a list to APNA of recommended books that I recommend to people. There's you're going to get a whole bunch of them. And we'll leave them perhaps on a wall. Actually, that's might be a good job. We'll put them on a wall, and any books that you know of, can you scribble, I've read this book, it is awesome. It's called 50 Shades of... So we'll do that. Karen.
Just sort of building on that, as I wandered around, I could hear some discussions about frustrations for nurses, feeling that their practice in some ways is being confined, is being restricted. And I think one of the important things there, and we also had the conversation last night with some of the group there, was that can actually lead to workplace boredom when your role is pulled down. And in a time when we're thinking about innovation, and one of the nurses up the back described, she feels as though she's being pushed back in a box. 40 years experience, wide range of experience, being pushed back in the box. And I think that those practices where that restriction is happening, they will be left behind. I think there's a glimmer of hope, particularly with healthcare homes coming, that there's the opportunity for innovation. And I touched a bit on it in my talk this morning, that there is that opportunity to use nurse clinics, enhanced nurse clinics, nurse-led clinics, whatever you want to call it, but to be smart with the nursing workforce, to actually use it to actually get through the load of patients that we need to see. So to me, there is opportunity coming. And I think Judith Hammond, who is one of they're our platinum sponsor, the CarePoint, Care Complete team, she said, I wouldn't go to a practice, she's a doctor, she said, I wouldn't go to a practice where they didn't employ a nurse. If I was at interview and they said there was no nurse, she said, I would just leave. So I think that's where we're going, and to take some hope that those practices that are holding you back will be left behind.
You think of where we come from and where we've got to, it's an amazing place, and we're going to finish this with a short video clip, about 3 minutes, and thank you for the generosity of the extra time, because I think it really draws together really beautifully some of what you've done this afternoon, and actually what happens when intuitively people start working together.
If you've learned a lot about leadership.
You've already learned a lot about leadership. Let's try this one.
Talking about expectations? Expectations. Watch.
Ba, ba.
Interesting to me about that is, regardless of where I am, anywhere, every audience gets that. But it doesn't matter, you know, it's just, you know, the pentatonic scale for some reason.
If you're looking for a job in neuroscience, I think...
The thing is this, wherever we go, intuitively we work together in tune for patients. We work in tune because we have a chorus of innate compassion, of courage, of commitment. We communicate, we care, and we're competent. And what we also have in this room today is great camaraderie. And that matters too. We're swapping notes, we're connecting with each other, another C. And can I just thank you all for your time, your generosity of spirit, and can I ask you to give it up for our really great panel this afternoon.